My name's Ed Hope, I'm a junior doctor from the UK and welcome to my YouTube channel. I usually do videos explaining medical terms in plain English, but today I'm going to do something a little bit different. I'm going to watch one of my old favourite TV shows before becoming a doctor, a show called House, and basically explain where the drama meets reality. For those who don't know House, it's a brilliant American TV drama set in a hospital following Dr. House, played by Hugh Laurie. Now House is able to make these miraculous diagnoses off very little information and treat some quite bizarre illnesses. The character is loosely based on Sherlock Holmes, hence the name House and Holmes, and he has a best friend called Dr. Wilson instead of Dr. Watson. And also he has addiction problems like Sherlock Holmes did. In the case of House, he's got this sort of chronic leg problem that he constantly needs to take painkillers for. Each episode follows one patient and he goes from not really knowing what's going on a bit of a journey with them and a bit of a puzzle and eventually finding out what's going on with them. I absolutely love watching this show before I went to medical school. Since graduating, I have seen a couple of episodes and it is interesting to watch. It can be a little bit cringy, the stuff that happens, but also don't forget I'm a doctor in the UK, so I think a lot of the things that I point out may just be changes in the American and the UK system. And also it's a drama, isn't it? So they're going to dramatise a lot of things that happen. I couldn't decide which episode to watch. I had a quick flick through the listings to see if there's anything that stood out from what I remember, but actually I can't really remember a lot about it. So I'm just going to watch the very first episode and and if it goes well, maybe I'll do all 100 of them or however many there are. I won't be doing that. So let's get cracking and let's see what happens in this episode. First up, these openings are genius. There's so many clues as to sort of what might be going on. I remember there's a British soap called London's Burning that followed a load of firefighters.
London's Burning.
What toothache, sir?
And the first 2 minutes would be typically someone in a workshop and the camera would be zooming in on the different things like the chemicals in the corner or a big spike hanging from the ceiling or, some gas next to an open flame, and you'd always be trying to figure out exactly what was going to cause the problem. Like, is there going to be explosion of these chemicals or is someone going to get impaled on the spike? It's a little bit like that with House. You always get introduced to the patient at the beginning in their environment and something happens to them.
C-A-L.
Blimey, so that's a pretty traumatic intro. Clearly anyone who finds someone in this situation needs to call an ambulance straight away. This loss of speech or change of speech we call dysphasia, and if it happens immediately, like sudden onset like in this patient, then you do need to call an ambulance straight away because it's a sign of a potential stroke. Clearly, in this patient's case, they've had a seizure as well, which also warrants urgent medical attention. So cue the slamming intro music of House. What? So normally the soundtrack is Teardrop by Massive Attack. Absolutely amazing song. I wonder they must have changed it in the early episodes. Let me try and find the intro that I'm used to. Here we go.
No one who can't talk. I like that part. She's my cousin. And your cousin doesn't like the diagnosis. I wouldn't either. Brain tumor.
So here he is, my man, Dr. House, in the Hospital. If you asked a lot of my friends why I became a doctor, they'd probably say I watched too much House in my 20s, which is obviously completely untrue. How dare they say that? I became a doctor to save lives, goddammit. Even if I ever did want to become House, which I didn't, his mantra is very much everybody lies. He hates chatting to patients.
Isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
In fact, he's pretty rude and obnoxious to them. As mentioned, he likes to make these sort of 1 in a million diagnoses as well. Basically, it's very much the opposite of my medical career so far. I really enjoy chatting to patients, finding out about their histories. You know, it's not just about their illnesses, it's about really how the illness affects them and how you can help with that particular thing. Also, I'm extremely bad with really random diseases. My knowledge is actually quite sort of generalised, but quite shallow as well, because I'm obviously only been a doctor for 2 years, so I'm not expected to know all these crazy things. So if I did want to become House, I've accidentally become the complete opposite. Not that I wanted to. So we've heard a little bit about what's going on with this patient. They've had these symptoms for a month now and getting a little bit worse. So at some point the team get together and have one of these huddles and form a differential diagnosis. Usually going through the patient's history, examinations, some initial investigations like blood tests and imaging, a consultant will know exactly what's going on, or in fact the pathway that they should be following to treat the patient. So these kind of huddles are quite unrealistic really, but they're quite realistic with medical school. So this is often how we teach things at medical school. You'll be presented with a problem and then people form groups and throw out ideas. So actually this is quite a good sort of learning experience for how that is done at medical school. Now the actual team dynamic is quite strange in House. So we have 4 doctors essentially looking after 1 patient. I don't know if this is more of a US thing, you know, having a private system where when you get the best you can have lots of, you know, medical input, but I think even that is sort of slightly overdoing it. So I'm pretty sure this is to dramatise the relationship between the doctors, you know, and to keep the show based on 1 patient and 1 puzzle and sort of 1 illness. So in a UK hospital, every patient is under a named consultant, and so they'll see that consultant on a ward round perhaps twice a week or maybe every day, and the junior doctors would be on that ward round, and then the junior doctors would see those patients every single day and carry out the consultant plan. And if anything changes, either sort of good or bad, they keep the consultant informed.
Aneurysm, stroke, or some other ischemic syndrome?
Get her a contrast MRI.
So they made a plan for this patient. I mean, the order of the investigations in House tends to be quite convenient. So, you know, as we heard in the intro, this patient has been having these symptoms for a month. So you'd imagine they'd probably want to rule out some vascular cause quite early on. So not having these kind of investigations done till a month later, you'd expect this stuff to be happening a bit earlier. Although I'm not an expert on sort of neuroscience, so study of the brain.
3 weeks. You owe me better than 4 months.
It's 5 o'clock. I'm going home.
It's 5 o'clock and he's going home. Well, this is the most unrealistic thing happening. A doctor leaving on time, particularly a consultant. They tend to have clinics that run pretty late, that get overbooked a lot. Leaving late is nothing unique to medicine. But anyone who's watching this thinking this looks like a gusty job, I can assure you this is a very rare thing in the NHS.
I want you to do your job.
But as the philosopher Jagger once said, you can't always get what you want.
Oh! Not a good way to speak to hospital management. Anyone coming into medicine wanting to have that attitude, you be in line for a rocky career, let me tell you. Also, every patient in House tends to be in their 30s, every single one, or sometimes they're a bit younger. Obviously there are some specialties in medicine, some procedures and things like that are more common to the younger age group. But the vast majority of unplanned hospital admissions are people in their 60s, 70s and 80s. I think in the case of House though, the story is that you've got a patient that's got something wrong with them, has gone to lots of doctors and then can't find anything wrong with them and then finds their way to House. So maybe that tends to happen in more younger age groups. But just as an observation, if you ever go to a hospital ward and expect to see loads of Hollywood looking actors in their 30s. That is not the case. It is much sort of older people with much more interesting stories. So basically the patient ends up having an MRI to have a look at the blood vessels of the brain, which is an appropriate test. What is funny is that the junior doctors in-house end up doing everything. Now, we like to think we're pretty good, but we certainly don't know how to do everything that is shown in the TV show. For example, actually running the MRI scan, the x-rays, being in the lab processing the blood results, and even in this episode, sniffing around a school to see if the carpets have some kind of environmental exposure. All these things are done by other highly trained specialists.
Hold her neck.
Oh, she's ashen.
She's not breathing. Epi.5.
As you can imagine, in each episode of House, there's a sort of twist and turn to the case, and there's at least one emergency that happens. Despite being so many doctors on hand, they never avoid the very uncommon emergencies. So usually something like vomiting blood happens or a cardiac arrest. In this case, the patient has an anaphylactic reaction to the contrast dye. So when they have these scans of the brains to look at the blood vessels, you put dye into the blood vessels so that when you take a picture, you can actually see the blood vessels more clearly. And it is a known complication. You can have these reactions. They're, of course, very uncommon, but, you know, so it is medically relevant. So when you have an anaphylactic reaction or go into what's called anaphylactic shock, this is a widespread, rapid onset allergic reaction that causes lots of swelling in the throat so you can't breathe properly, and also causes your blood vessels to become wider, they dilate, and so your blood pressure drops. It's a life-threatening emergency. You may have heard about it when people have peanut allergies or bee sting allergies or allergies to latex, and that's why people carry an EpiPen. So in this example, that's why they grabbed the epinephrine, so that's the drug that's in the EpiPen, also known as adrenaline, and this reverses the swelling in the throat and helps to restore the blood pressure. It only works temporarily, so if you ever give it, people still need to come to hospital and still need urgent medical treatment, but it's something that will save lives if given very quickly.
Too much edema. Where's the surgical airway kit?
Yep, coming.
So notice how calm everyone is in this emergency. You can only really tell from the camera direction, the editing and the music that something really dangerous is going on. And this is exactly what happens in an emergency, really. You'd maybe expect everything to just go really hectic and people shouting and running around, but actually we try and slow things down, being very clear communication and very methodical in our approach. This isn't totally realistic though, because we have 3 doctors here and no one gets help, and this is the most important thing to do initially, because if this patient symptoms progress so they're unable to get the airway open or restore blood pressure, and this patient will have a cardiac arrest, and you have lots of people on hand. So all hospital rooms have buzzers in, and so the first thing one of those doctors should do is put the alarm out to make sure they've got help coming. So they've managed to intervene in this anaphylactic reaction. They've had to put a temporary airway in, so things aren't really looking good for the patient, and they still don't know what's going on. I have no idea if they managed to rule a stroke in or out, but now they're going to try the patient on some steroids. Steroids reduce inflammation, so in terms of this patient's disease, if we're thinking about a brain tumour, the symptoms from a brain tumour are caused by the tumour growing and squashing parts of the brain, so that part of the brain doesn't work very well, so that's why you get the symptoms. But also within tumours in the brain, we get inflammation around the side of the tumour, so some swelling as well. So this causes additional pressure, causes worse symptoms. Therefore the steroids don't affect the tumour, but they help affect the swelling around, so therefore improve the symptoms. In this episode as well, they were thinking about the blood vessels, and there's a rare disease called vasculitis, which is inflammation of the blood vessels, and when they get inflamed, blood doesn't flow quite as easily through them. So therefore the steroids are also there to try and cover that, because if they can reduce the inflammation of the blood vessels, help the blood flow, therefore the area of the brain that isn't getting the blood flow and therefore causing the symptoms, the blood flow will be restored and the symptoms will get better. In fact, will actually treat the patient in that circumstance. Again, this is medically accurate, but timings wise, probably a little bit off. If someone's having these symptoms from sort of compression of something in the brain, say a month ago, they probably would have been tried on steroids a lot earlier on. And also the patient's just had an anaphylactic reaction, and our treatment that in the short term is also high dose steroids. So sort of medically accurate, but again, timing wise, maybe slightly off. The white coats is an interesting one. I think it's an American thing generally to signify who the doctor is and also protect the doctor's clothes from bodily fluids and spillages and things like that. In the UK, we don't wear white coats. I think it's mainly for infection risk, so we tend to be bare below the elbows. And also we tend to wear aprons, sort of disposable aprons, if we go into patients that have a known infection risk. It can look a bit odd though watching these American dramas where they're not bare below the elbows. Every single health professional on the wards will be bare below the elbows, as our former Prime Minister David Cameron found out so infamously, where he brought a film crew around a patient's bed and wasn't following procedures.
I'm the senior orthopedic surgeon in this department. Why is it that we're all told to walk around like this? I'm not having it. Out!
Just goes to show how seriously and how rightly we take infection risk within hospitals. So as I say, on this roller coaster of an episode of House, the patient gets better on steroids. One of my registrars always used to say to me that the job of the doctor was just to look after a patient until they get better on its own. Maybe we stake a claim to do a lot more than we actually do. For example, when we treat an infection with antibiotics, we probably don't realise how much the patient's immune system is probably fighting the infection. All right, we're just giving that extra helping hand to help things, and yet we get a lot of credit for it. How could I have forgotten about this? In a way to dramatise the episode, they always tend to visit the patient's house. And when I say visit, I mean break into the patient's house. Probably because they don't want every single scene to be shot in a hospital. Clearly, this is 100% accurate. I used to love my locksmith skills when I was studying at medical school, and at the moment, you know, every other day I'm breaking into people's houses that are in hospital. There's probably some weird doctor that once broke into someone's house and found out what was going on, and then that's probably where they got their evidence base from, but certainly this doesn't happen. Particularly because in this episode they then also help themselves to the patient's food, and they end up eating the patient's ham from the fridge, which is something I've never done. So the patient initially got better, but now gets worse with steroids, hence the roller coaster of the episode. What could be going on? So because the patient hasn't improving, they've had another one of these huddles, and inevitably the moment happens where House cracks the whole case. So let's wait for it.
You idiot! Listen, he's not you, him. You said you didn't find anything.
Everything I found was in
You found ham. So, where there's ham, there's pork.
Where there's ham, there's pork. We've got it. The diagnosis, guys, ham. Cracked it. Wait, what?
Where there's pork, there's neurocystic cirrhosis.
Tapeworm? You think she's got a worm in her brain?
It fits. Could have been living there for years.
So there you go. They've cracked the case. So the patient had eaten some pork or ham that had had some worms in it. They'd eaten the worms, and the worms had travelled through the bloodstream and ended up infecting parts of the brain and ended up growing there, and that's why they got the symptoms. So it wasn't a tumour, it wasn't a stroke, it was this worm in the brain. So they can just give them some medication that isn't too harmful to the person but can kill the worm, and they're going to be cured. Woo! This is it. This is exactly like how medicine goes. So then we have a nice sort of happy ending. They don't mind about not rolling their sleeves up or operating the MRI scanner without permission. But yeah, letting loads of kids run on the ward, brilliant. So funny enough, on the last scene of this episode, House watches a medical drama. I mean, what self-respecting doctor would ever be caught watching a medical drama? They surely have more important things to do. Jesus. So that's the end of the episode. I hope you enjoyed that video and it's given you a bit more of an understanding of where drama meets reality in this medical show, and that maybe you've learned something. You've probably learned less than when you watched the video. I mean, I've certainly learned something, and I can now think about worms in my differential where I meet patients, which is, again, probably not going to be that useful. If you enjoyed this, I do a series of videos called Sick Notes where I explain medical terms in plain English. You can check that out on my YouTube channel, and there's some other videos that I do similar amazing things like looking at this house episode. But thank you very much for watching, and goodbye.